I'm coming back to you this time to talk about my breast reduction surgery. I am currently 3 days post-op. This is what they recommended: front opening sports bra, which is what I have. I have a hospital gauze bra underneath, and this is basically what it looks like now with reduction. I'm assuming some of this is swelling and will go away over time, but this is basically what I look like after my reduction. Now, also, I have been going through the Tummy Tuck BBL journey. I don't have much really to add to that. Still dealing with some swelling. I have on this waist trainer. I always try to have something in this midsection compressing this area because it will still swell without the compression. But I can see my results from my BBL or whatever. I mean, I can take this off so you can, see like my belly. So this is from my BBL portion and what it's looking like. As far as everything else, I'll show you guys my bum. And I try to keep this compressed so that my waist will be small and not just square, but actually have kind of like a figure 8 shape instead of just being a square shape. So I keep this on. If I don't have this on, I have the faja that squeezes this part in a little bit more open for the thickness of my thighs, and with the mesh around the buttocks area. But there was a lot I wanted to say. I didn't do a lot of preliminaries leading up into my breast reduction. I had a pre-op appointment about 15 days prior to the actual surgery date. They took my blood to make sure my hemoglobin was right. Honestly, I don't know what it is right now. I think when I had my BBL surgery, my hemoglobin, I believe, was something like 11.9. I'm not sure. So I guess, I didn't even check with the doctor, but they still scheduled me for the surgery. So I'm assuming all of my blood work came back fine. I didn't have any problems with not enough iron intake or anything like that. And let's see. So I just went in. It was almost just like how it was when I had the tummy tuck surgery. They wheeled me into the operating room. Then the next thing I know, I was waking up. I didn't know at what point they put me to sleep or what happened. I was waking up. Everything was already done and my chest was wrapped up. As far as my recovery, you get sent home the same day. They do not keep you overnight for a breast reduction surgery. So it's just a matter of waiting for you to come to, and then actually feeling, I guess, good enough that you can walk. Well, not necessarily have to walk, but that you're up, you're kind of alert, what's going on around you. And when I woke up, I had a lot of pain. Most of my pain from my breast reduction is the incisions up underneath. This is the part that I get most of the pain in. And my incision comes almost like to underneath my arm on both sides. And just doing this, it's very tender. They gave me Norco, which I believe I took that the very first day, like clockwork, every 4 hours or whatever. But after the first day, I didn't want to feel like that all day. I had a class that I'm taking and I need to get the work done. So I stopped taking that. I've been taking extra strength Tylenol. And just for today, I started taking the Arnica tablets again, because that will help not only with the pain, it also helps reduce swelling as well. And I will be drinking the tea because I'm almost out of the pills, but I still have a lot of the tea. I apologize about that. Like I told you guys, I record from my phone. So someone just called me, so it just completely knocked me off my video. Anyhow, I was talking about the tea, so I'll be taking the Arnica tea that's going to help with the swelling. I don't know what my end-all breast size will be. This right here, I got this from Walmart. It's at 2XL, and that's what fit me. I looked at a large. I didn't see a 1XL, and the regular large looked way too small. So this is a 2XL sports bra. It's holding me in because you still need a lot of compression on the area that's been worked on. So this is, I don't know if you can tell, but it's just like smashing it down inward. And that's fine. Like I said, the only thing that's really tender are the incisions that are up underneath the breast. Like I said, as soon as I touch it, that makes me want to cringe. But what else? So anyway, when I awoke from my slumber from my surgery, I was already in the recovery area. You know, it's just a bunch of beds back there with everyone who's had surgery for all different types of things. And then they just have the curtain around your, your bed or whatever, but the front is open so you can like see through the hallway and all of that. So, I wanted to say, or wanted to explain my experience that I had with a nurse that was assigned to me. So the first thing that I didn't like, and maybe, I don't know, there was nothing to not like about it, but it's like she stayed at my bedside the entire time. So I woke up, I saw her there. My mom and my daughter came with me. None of my loved ones were there, but I was looking around and I saw that other people who came with their husbands or whoever, they were in the room with them during the recovery. Well, I asked my nurse, can she please let my mom come in, and she acted surprised, like, oh, you want your mom in here? Like, yeah, that's why she came. Like, I wanted somebody with me, So she's like, oh, I'll do that after I do this. So I don't know, she's sitting down on a computer right next to my bed, and I don't know what she's doing. Anyway, she's like, oh yeah, after I'm finished with what I'm doing, I'll get your mom or whatever the case is. Then I started to tell her, like, you know what? I'm in pain. Like I said, the part that hurts is up underneath here. And I just kept feeling like the pain was getting worse as I was laying there. And I told her, I'm like, you know what? I'm really starting to hurt. I need some kind of medication or whatever. So she was giving me single dose of fentanyl, 25 mcg, I believe it was. And I think the total dose that you can take of fentanyl is something like 100 is like the highest dose. So she asked me what level is my pain. I tell her it's probably like about a 7. I didn't want to say 10 because if it was a 10, I'd be screaming and hollering. So it wasn't a 10, but it was really hurting. I told her about a 7. What she did was she inserted the fentanyl into my IV. So pretty quickly the pain started subsiding. I was feeling a little bit better, and it seemed like it was getting okay. She asked me what was my pain level. So it hadn't gone all the way away, but it definitely wasn't hurting at a 7 anymore. So, I told her, well, like my pain level is probably about a 5 or whatever. She's like, oh, that's good or whatever. And, I didn't know that those doses would only last for a few minutes. So probably 20 minutes go by and now I'm in pain again. And I'm telling her, like, you know what? I'm hurting again. I need you to give me something. So she continues to give me these 25, I think, mcg doses of the fentanyl through my IV, but it only lasts for about 20 minutes, which was getting irritating because I felt like it was making me high, it was making me dizzy, it was whatever, but it's only lasting 20 minutes, and then I have to get all the way back into complete pain, and then for her to give me something to make the pain go away. I didn't like that. When I had my tummy tuck, whatever they gave me during that time, between whatever they gave me during the surgery and me actually taking the Norco that they prescribed me, I didn't feel that pain, period, at all. I took it like clockwork. Like it was the itty bit that I felt something was starting to hurt, I would, go ahead and take the dose. So everything worked out perfectly, and I never had to get into excruciating pain to then say, oh, well, this is hurting. And it seems like she was just waiting until I was already in complete pain before she would give me another dose. So that was irritating me. That's the problem that I had with her. And so I told her again, now this is about the 3rd time. I'm like, first, where's my mom? I asked her 3 times for my mom before she ever went and got her. On the 3rd time that I was asking, it was at the same time I had told her, you know what, I'm in pain again. I need you to give me another dose. So she gave me another dose. And then she's like, oh no, I have to observe you before I go get your mom. Mind you, you've already given me these doses. I don't know how many times. This is a room full of nurses and doctors. It's okay for you to get up. You don't have to observe me that closely. You can get up and go get my mom. You know, I just felt like she didn't want to get my mom for me, and I just had a problem with that. So, anyway, one of the things that she did go get my mom, but one of the things she kept saying was, take deep breaths, take deep breaths. This medication affects your breathing, so take deep breaths. Now, meanwhile, I felt like I was completely normal. I thought I was breathing normal. I felt fine. For all intents and purposes, I felt fine. I mean, I know I just had a surgery. Okay, yeah, it's sore and all that. But as far as my breathing and, I felt fine. And every few minutes, she kept saying, take a deep breath, take a deep breath. So she made me feel like I wasn't getting enough oxygen. So then at that point, I was just afraid. And I'm like, am I not breathing right? Because to me, I felt like I was completely breathing normal and right. And she kept touching my arm saying, take a deep breath, as if somehow it was showing like I wasn't getting oxygen. But I felt fine with the oxygen I was getting. So I didn't want to fall back asleep, but that medication makes you so groggy, and I'm like fighting myself to stay awake. So everybody else, while they were in their stalls, kind of like sleeping, being able to sleep off their medication from the anesthesia and all of that, I was wide awake because the lady made me so paranoid, making me think that had I just closed my eyes and went to sleep, I wasn't going to breathe properly. So I'm forcing myself to stay awake the whole time. I stayed awake the whole time in the recovery room. I didn't get to take it. I should have been able to at least take a nap, sleep some of the anesthesia off, or I couldn't because she was making me so paranoid. And on top of that, I needed the medication every 20 minutes for this to not be hurting me, And so anyway, when my mom came back, I was trying to kind of explain to my mom, and I really couldn't talk as well as I would like to, because it seemed like every time I wanted to say something, I was going to burst into tears. Yeah, I wasn't going to burst into tears because I was in that much pain. I just think it was some type of effect of the anesthesia. So, I'm trying to explain to my mom, like, whatever she's giving me is only lasting for 20 minutes. As far as I could understand, or what my understanding was, even though I was inebriated, and as far as I'm concerned, high off of whatever medication she was giving me and anesthesia and everything else, I'm still trying to, talk legibly and say what my needs are, And so after complaining that the medication keeps wearing off, then the nurse finally said, oh, well, we could get you like some stronger medication. So the first thing is, she was giving me the smallest dosage of the medication she decided to give me, which was the fentanyl. But then she said like they had Dilaudid and some other things that would take the pain away better. But I didn't understand why did you tell me when I said my pain went from a 7 to a 5? And that it wasn't completely all the way gone? Why would you still only continue to give me 25 milliliters? Because you never got me out of pain at all. And there was a higher dose you could have given me of the fentanyl, plus there were stronger medications you could have given me so that I didn't have to lay there in pain. And I said, I'm so glad that I actually did my tummy tuck first, because had I did the breast reduction first, and the way she's explaining, oh yeah, you're still going to be in some pain, if I would have experienced that first, I would have never did the tummy tuck. I would have been afraid to do the tummy tuck because I don't want to be in pain. And honestly, with my tummy tuck, I just didn't get into the pain like that. Like I said, the only thing that hurt me very bad was when I had to cough or sneeze or something like that. But as long as I was relaxing, I took the medication on time, I wasn't in excruciating pain. And this lady is trying to explain to me that, oh, because I had surgery, I should expect that I'm going to be in this pain. And there's not going to be any medication that's going to be able to make me feel like there's no pain. But that was not the truth. She actually had stronger medications that probably could have brought me down to like a 2 or a 1. She just chose not to give that to me. And it wasn't until like the last, like I finally was like, I hadn't seen my daughter yet, my 24-year-old daughter. And my mama had been sitting there with me for a while. So I said, well, let my daughter come in. And the thing was, I didn't want to cry in front of my mom. I knew I couldn't talk. It was, for some reason, that medication, every time I would try to talk, I would start crying. And I didn't want my mom to worry about me. So I was like, can you have, have my daughter come in? So they had to switch places because only one person could come into the room at a time. So when my daughter came in, I just had to give her the whole breakdown. Like, I'm in pain. This is what the nurse is doing. And meanwhile, it's like I'm pouring crying, like, because I'm in pain, and I just felt like she was intentionally keeping me in pain. Like, why are you doing this to me? So, so I was telling my daughter, and I didn't mind crying in front of her because she's not as sensitive as me crying in front of my mom. My mom would start crying because I'm crying and that type of stuff. I knew my daughter wasn't going to do that. a little bit more emotionally stable. But, you know, so I was able to articulate to her through my tears what was wrong. So, you know, my daughter finally told her, like, just give her the Norco, because they had gave me Norco to go home with. I had already picked up my prescription like 2 weeks before I even had the surgery, and I had it in my bag. And so my daughter just was like, well, you know, just give her the Norco pill. Therefore, she doesn't have to keep asking for pain medication every 20 minutes. So then the nurse was like, oh, well, I have to get an okay through the doctor. It's like, we don't care what you have to do to get this situated. Please just do what you need to do, because I don't want to keep every 20 minutes this mess starts hurting like crazy, you know. So finally, I got the Norco. The pain subsided a lot better with the Norco than it did with the fentanyl that she was giving me. And I was cool from there, and I was able to recuperate enough where I just didn't feel as drowsy, as messed up. Shortly after, was able to leave from the hospital and go home. And then I was fine with that. And then, like I said, that very first day, I just stayed on the Norco every 4 hours. By the second day, like I said, I'm taking an online class. I'm like, I can't stay awake. I can't think straight. I can't. So I was like, I can't take that. But I did start taking just regular Tylenol, extra strength, regular Tylenol. I would take 2 of those. I haven't taken those since yesterday, and today I'm starting on the Arnica pills, because it's not just a pain reliever, but it helps with reducing swelling and a lot of things that I'm happening. And I noticed that since I got my breast done, I'm getting a lot more swelling where I have my tummy tuck as well. Because I guess these 2 compartments are connected, I guess, technically speaking. So I had to start getting a lot more swelling in here. So I had to deal with that. So that's why I'm going to take the Arnica, because it deals with swelling as well and not just pain relief. So again, like I said, 3 days post-op for my breast reduction. I actually was able, they said after 3 days, you can take a shower. My doctor said she did inside sutures, and then for the outside sutures, she uses a suture glue. So I have suture glue around, my areolas. I have suture glue around the cut, underneath. And the very first day, they said I wasn't supposed to take my bandages off, but because the way they wrapped them, they kept just like falling down for the most part. So I was able to see what my chest looked like at that point, and I didn't like what it looked like. It had looked like it was like around my areola, especially the one that's on my left side. Like my areola was like it was bunched up or gathering around. And it did look like there was a substance on it, like it got glued or whatever the case is. So I made an appointment to come back in because I want the doctor to look at it, because I was like, I don't want it to heal with pleats on it or whatever the case is. But after seeing the doctor, they assured me that, you know, yeah, it does have glue on it, but it's not gonna, right, it's the part that needs to heal around the areola, like that should still be a straight part. I'm just seeing that it's kind of like the glue has this nipple smashed down. There's no glue on this nipple, so this one's sticking out. This one is smashed, taped down with the glue, or however you want to put that. I don't know. But, and then it's a lot of bruising. It's huge bruise, black and blue up underneath at the incision points. But again, I'm not worried about it. When I had my tummy tuck, that looked terrible. You cannot tell what your end all result is going to be, you know, just a couple of days into healing. So I don't have any thoughts as far as, like it wasn't a good job or anything like that yet. I have to wait for it to heal. They just told me like my chest is going to form more and a lot of things more. And, you know, within like 2 weeks or so. Well, no, I think they said a full 3 months is the whole process. But, you know, it'll start forming and looking like what it should look like once a lot of the swelling and everything goes away. So that's what they were able to tell me when I went back to that follow-up appointment. Then I have one more scheduled follow-up appointment on the 11th of June. And then they said after that, I don't have any more follow-up appointments regarding this. I mean, unless there's something going wrong about it. So, that's pretty much where I'm at on my breast reduction surgery. I'm so happy that I did it. I'm just so happy that I did it. I just can't even explain it. Like I said, for it just giving me an option or a chance, or I feel very hopeful that I won't have as many, back and neck problems. And I'm very, hopeful as far as being able to find shirts that fit me properly, because that's always the thing. If you get a button-up shirt, I don't care how big you try to get your button-up shirt, the buttons always pull apart right here. I always end up having to put a safety pin because the buttons pull apart on any type of button-up shirt. It don't matter how many sizes I try to buy it bigger. It just always would pull right here. I initially started at a 36 triple D slash F. Triple D and F are kind of supposed to be the same size, but that's basically what I started out as. I don't know what size I am now. All I know is this is a 2XL sports bra. And that, just taking into consideration, that's not necessarily all of my cup size. My cup size is much smaller. It's just I'm kind of weighty around my back area. So that's that. But I am, like I said, looking forward to great results. I'm already happy. Like, I took off all this off. I put on a tank top and loved the look already. You know, even though I'm not healed, I just like the fact that my chest wasn't hanging down to where my belly button was. Okay. Like, I'm already happy about that. So that's pretty much all that I have right now, as far as my breast reduction surgery and where I'm at with it, and my experience about it so far. If you have any questions, please go ahead, comment. I ask you to also like and subscribe to my channel. I would greatly appreciate that. And thank you so much for spending this time with me, and enjoy the rest of your day. Thank you.